Now, since we began recording the novel coronavirus, cases in the country, well, some particular workers have had to go the extra mile to ensure that you and I are safe. I'm speaking of our health workers as well as our security personnel. Now, speaking of the security, the police and the military in particular were tasked with ensuring or enforcing the lockdown. Now, after the lockdown was lifted, they went back to their homes, their barracks, in their stations. Cases of security personnel, being infected with the coronavirus. And a lot of these individuals have been, quarantined, they have been treated, and a lot of them have recovered. So today, we are coming to speak to one of such individuals who was infected with the virus and ended up in one of the isolation centers. He, fortunately, alive and, out. Senior, how are you doing?
I'm doing very well.
Share your story. How you came, to be infected with the virus.
I actually don't know exactly where I got it from. I can't pinpoint and say that I had it from here or not. But I suspect I had it from a vehicle because I had to travel. I had to commute to work every day in through all this.
How did you receive the news? Was it random testing?
Yeah. So what happened was that I was working on a case. There was a suspect that I was working on him. And then we went to court. He was convicted. And so when he was convicted, it became necessary that we had to let him undergo COVID-19 test before we sent him to prisons. We took the sample of the suspect, and I also volunteered. I wanted to be tested because, yes, so that's how I tested. That was on the 12th. On the 20th, the results came, and it was positive. Then I think I saw my madam. I saw her missed call. I saw my commander's missed call. Then just as I was about to pick the phone, she called again. And then she also directed me to call Dr. Tunyakon, who is DCOP Dr. Tunyakon, who is also head of public health of Ghana Police Service, so at the police hospital. Immediately I called Dr. Tunyakon. He was like, okay, we'll bring ambulance to come and pick you. And I said, no, I didn't like ambulance. Ambulance, no.
Because of the stigma,
Yes, and it will create situation in my area, so I don't like. Then doctor was like, oh, really? I said, yes. Then he was like, what happened? I said, okay, I'll come. I told him I'll come. Then he was like, okay. No, I told him you should wait. You should be at the hospital. I'll come. It's okay. So I just picked my nose marks, picked few things, got to the roadside, and there was a coming taxi. So I stopped the taxi, told the driver that, look, I'm COVID-19 positive, but I want to get to the hospital and be quarantined, so you just assist me. So then he was like, okay. So then he was not having a nose mask, but he took a duster and tied his face with it. Wow. And then he asked me to sit down. He opened the doors himself, and then he asked me to sit down. So I sat down in my nose mask, and then by 15 minutes time, I was at the police hospital.
Wow. Now, speaking of your wife, now you've left there and the kids. Were they tested, and what were their results?
Yes, my wife and child tested negative.
For a lot of people, they recover, they go back to their neighborhoods, but then they are not received and welcomed well. Have you faced, this since you returned?
In fact, I didn't get to the house before I started talking about stigmatization. What I did was immediately I was discharged from police hospital. The first thing I did was to put a post on Facebook. I have recovered from COVID-19. And so people were asking me, those who know me, they were like, that's one of your usual jokes. So I had to put the notification letter that I was given by doctor on my wall for people to know that, look, indeed. And then people were like, oh, really? Then I started having a reaction all over the country. Friends, people are calling me all over the country. People are like, some of them were playing to me like, look, I never believed this until you mentioned that you've recovered. And when I came back to my area, Abokobi, if you meet me and you tell me that, Abain, they usually call me Abain or a hunter here because I used to play. I still play football with the local boys. There's a football park, Colombia. All of us play there, so I am known in the area. So if you see me and say, Aba mi hu wacho so minya coronavirus so na maba. Then they are like, are you sure? I said, yes. Hey, Abain, it is saying like, how do you feel? I said, me de minya manyari manyashe, nothing happened to me. We're like, oh really? And so by the time I got to the house, I have already killed the stigmatization issues, and I was publicly announcing it, so the news was getting ahead of me before I got to the house. So everybody knew that, look, the guy has gotten the coronavirus and there's nothing wrong with him. So for me, I am here to Yes, I'm here to see someone who yeah.
And I mean, you just returned, but are you concerned that people might start, distancing themselves from you in the coming weeks, and so you're not concerned at all?
In fact, I have no worries about them. In fact, I should be scared about those who I don't know their
status.
Yes, for me, clinically, I've been cleared. Doctor has, several tests has been. Yeah. So I should be very careful about you rather. So if there's someone who should be running, I should be running from those who, yeah. So I don't have a problem with someone who wants to run away from me because I tested COVID-19, I recovered.
I'm sure you've had time to think. I mean, you used to pick churches, to and from work, places you used to go to. What measures, from your end, are you putting in place? Would you be now concerned about even sitting in the church, and returning back to work and all of that?
Yes, that is what. It's a headache, but I think still man would have to live by it. Because as at now, I don't have a vehicle of my own. And how do I have to go to work? And I wouldn't want to say because of COVID-19, I wouldn't go to work. I have to go to work. I have to still work. And so it's a worry.